Well, hey there, y'all. Just a quick reminder, this podcast's for fun and information only. It ain't medical advice, and the views are ours, not our employers.
Hey everyone, welcome. Gosh, it's been a while. I don't even remember what our standard intro spiel is anymore. But I'm Brian Bost. I'm an internal medicine pediatric hospital physician, and with me is my co-host, Dr. Meshkaty.
Meshkaty.
Forever. I think. Why do I still do that? I think it started as a joke probably 10 years ago, and I just refused.
I'm just kidding too, because I think it's hilarious.
I know, right? It's so funny because when I ask Siri to call you, that's actually how I do it too. How is sunny California today?
This is one of my favorite times of the year because it's like almost spring. This space between winter and spring, and I mean, I really can't complain because there's blizzards out east, so I feel grateful.
Yeah, kind of crazy. I remember our first nor'easter, or my first nor'easter in residency. I grew up in Colorado. No one ever accurately predicted, the weather back then as a kid. And I was in the hospital and the nor'easter came through, and I just couldn't believe that they were canceling clinic in the afternoon and kids were getting out of school. And I remember, I think I was on medicine wards. And I just remember watching the snow come in. And then, of course, it dawned on me I was on late call. So I was just on call till 7. But night float couldn't come in. And I just remember I think I finally left at 2 in the morning. And I went out to the parking lot. And mine was like the last car there. It was buried under all the snow. And of course, I had a Jeep back then. So I went driving in feet of snow. But then I actually had strong appreciation for this concept of the nor'easter.
Well, also, I mean, that's great that you had that experience because I didn't. I had my little Volvo non four-wheel drive driving through blizzards in Massachusetts. But most of the time, I think I was just stuck in the hospital
Yeah,
because where would I be anyway?
right.
White knuckling it on the highways trying to get, or just when getting snow off your car. I mean, all that has been, I take it for granted and I'm grateful. That's why I chose the way that I chose.
The other night, I had to go into the hospital unexpectedly in the middle of the night. When I'm here on my rotation, I'm parked outside, which is fine. But usually, I don't zip into the hospital previous to working in these environments. I had the windshield wasn't defrosted. And, it's kind of funny. I was like, wow, I'm like living the life. I've either been in the hospital or I've had a heated garage. And now all of a sudden,
Roughing it.
Roughing it. Yeah, and I was thinking back to residency. I actually was chatting with one of our co-residents a couple of hours ago, someone who works as a hospitalist, and we were chatting a little bit, and I was thinking back to residency, so I threw on a fun pediatric background for today.
Yeah, that's nice. I definitely miss the kids. So, yeah, it's good to remember. I don't know how the state of the pediatric hospitals are, but I think they're struggling. I think the pediatric ICUs are struggling, and obviously the specialists.
Yeah.
But I mean, with the old model, and I don't know, it feels like we're in transition, so I'm not really sure
Yeah.
what we're transitioning to, but yeah, we'll see.
Yeah, it'd be fun to get, somebody who can talk about kind of the healthcare economics. I think one of the things I've seen recently is this arbitrary downgrading of reimbursement for visits by health insurers, right? And so, just for readers, every time we see a patient, we code a 99213 or 99 whatever, which is I spent this amount of time or I did this much in a visit, and so that has a standard charge. I obviously don't do a lot of coding, or I could tell you what a 99314 or what other, but that's, and then your documentation has to prove it. So, and now there's just this arbitrary, like, you're overcoding, we're downgrading. And
Yeah,
so,
it just reminds me of that chart in that article you sent with the physician or the administrator bloat.
yeah,
So like over however many decades, the
yeah,
physicians on the scene has just stayed stable. And
yeah,
then the chart goes like through the roof for
yep,
so this whole billing and coders, and which obviously are quite important, but like the tangly nature of all these systems
Yeah,
like acts like it requires a lot of people to like go and weed through the tangles.
totally.
But it's like maybe just we don't have the tangles to start with.
I know, I know.
There's
Well,
that.
the system has now gotten so big it has to pay for itself in ways that it didn't. I kind of think about I'm obviously in a rural farming community, like what's the n number of ideal children to have to help make a farm sustainable, but then to not increase the cost of needing to work just to feed more, right? Like I kind of think in those terms of, healthcare is now so heavy with non-clinical people because it's a business.
Yeah, and I mean, again, I think hopefully we all agree on that by now. Whether it was a consensual process is a whole other story.
Yeah.
Because, I know we've talked about this before. Like, I'm not cut out for business. I don't have that part of me. I don't have the strength to do transactional stuff. And I also just believe that the field is not cut out for it. So, like, the field, it's not even about me personally. It's like we're talking about the most vulnerable time of a human life.
Yeah.
And I remember just being like, when the wind really left my sails, was when I realized that we're all out there, like out, because we've been in the hospital for what, 20 years? Out, the people that were out there, not at the bedside of sick and dying humans, were all fighting over something or another, or they were treating each other a certain way that wasn't ideal. Meanwhile, we're at the bedside and we're witnessing how the external system and the forces treat this dying person right before our eyes.
Yeah.
And like, I remember just being like, if we can't get it right in the hospital in this moment,
Yeah.
then everything out there is secondary. Like,
Right. Well, yeah, and also our primary care colleagues, it's the same, right? Well, insurance was meant to have a catastrophic coverage of, holy cow, you need your appendix out, somebody has to pay the hospital. Most people don't save up for an emergency appendectomy, and then, the doctor's visits slowly got shrunk. If a primary care knew that they needed an hour with you, they would book an hour. I mean, we actually could do that in our residency clinic. We were able to say, hey, this is complex, we need a double visit. But those got shrunk down to 15 minutes.
Autonomy. Now we're talking about autonomy, which,
Autonomy, but also the finances, right? Because it continued to squeeze. But then to make that schedule more efficient, you needed somebody really to take over scheduling. And, just it all kind of grew out of proportion. And I think probably a lot of it ties back to health insurance and also, living in a society where healthcare is a it's a business that is even in a nonprofit system, you still have to,
so I
it
think
makes money.
it just reminds me of transactionalism.
Yeah.
I believe, whether it's true or not, I believe we are in a transition from transactionalism to, I don't know, relational.
Yeah. Yeah.
So that it's more like, instead of an extraction, it's an exchange.
I have to close two communication loops. So two things. One is the changing relationship. I think that is true. And I'm going to come back to that because I wanted to say there are many different types of healthcare settings, and having my training in Ireland, having lived elsewhere, we both have, there are definitely better models. No model is perfect. And so, sometimes this conversation is misinterpreted of, are you saying we should have socialized medicine? I'm saying there are difficult decisions to be made, and how a country or a people embrace the philosophy of healthcare. Is it a right? Is it the same right across the board? Are people willing to pay higher taxes for it? Like, I don't say this is not a comparison study of us versus a socialized medicine or what have you. It's just recognizing that as two of us who work in the system, it's broke.
Yeah, and it's nuanced. So unfortunately, you have to say that because people automatically, like, for example, for me, if I'm not, pro this, then I must be fringe. or if I think I like to drink a lot of herbal teas, so I must be fringe.
Right.
It's like automatic. But
Right.
that's a limitation on how small we've become with pitting against each other and tribalism, and I don't know about that. But so like the spaces in between, and I feel like hopefully we could talk about the spaces in between, because we're, from our perspective at least.
Yeah. And I think there are good changes that will come about. And, not to delve kind of too deeply, I'm really like thrilled to see physicians reclaiming a lot of ownership of healthcare models. And I think there's a lot of exciting things that will happen, because maybe the benefit of becoming full consumerism is, if you can afford a YouTube TV subscription, you can afford different access on top of your insurance, making insurance kind of almost like catastrophic coverage that it would be.
Yeah,
anyways,
you're going into a little bit of whatever this direct primary care. I don't want to say it's gone viral or that it's like the next trend, because I think what I appreciate about it is, again, it goes back to like cut out the middle people. Like, we are gifted. We spend so much time learning. We love the healing arts. We kind of know in our guts how to practice it. And if it's not in an environment that's conducive to that, then of course, like, we lose autonomy and blah blah blah. But yeah, I think cutting out the middle people, which is why direct primary models have taken root, because the other way wasn't sustainable, and we knew it wasn't going to be. Right. It just, like, I guess I didn't know if it was going to be in my midlife career or even in my lifetime, where I'd be like, oh yes, remember all the times that I was like screaming in the void, which, by the way, like, I don't really do that anymore. But
and I think also, it's also direct everywhere. There's direct surgery centers now, direct cardiology. And again, part of that is, let's actually reuse the term flatten the curve. How about that? Like, let's make that, instead of COVID times where we reduce the disease transmission, let's bring flatten the curve to, how does healthcare remove the excess expense of the widening gap between administrators and physicians. We right here will call this a what the health flatten the curve.
Well, now I'm getting inspired, because I've been waiting on the edge of my seat for direct hospitals. Yeah. Because I have historically not had a welcome seat at the administrative table, to say, because, I just feel like, I just like things to be done in a practical way that helps the people on the ground. So I think direct hospital. And then, like, while I was thinking that or saying that just now, I was thinking of a home hospital. Yeah. Honestly, like, if my home is very healing for me. So if there was someone that could virtually, like a hospitalist like you, virtually take care of me while I'm at home, and then, just send ancillary staff to kind of help with IVs, just like we do with like home help when someone's on home with antibiotics, right? Yeah. We do like an OPAT model. And I think they're doing it,
Yeah, I think they are. I think Kaiser California, and I think actually, I can't forget which group in Boston, really are. But we also know, like, it's kind of funny. I find myself oftentimes having a conversation where, a family is rightfully worried about if it's the right time to go home. I always say, listen, I send you home. I don't expect to see you back in the hospital. And it's kind of how my own internal litmus test is. But also I say, when you get in your own home, you get off of all precautions. You can get to the bathroom by yourself. You're motivated to do things. You get the foods that you want. And yeah, just the healing nature of the constant alarms, 2 a.m. vital signs that aren't necessary. I oftentimes, and I'll have to go back to the Institute of Medicine, pull the most recent statistic, but, when I was starting hospital medicine 15 years ago, one of the arguments I had about the risk of being in the hospital was, at that time, the Institute of Medicine had published that there's 200,000 preventable deaths in the hospital every year. That's you fall, break your hip, and you succumb to that, or it's a medication mistake. So yeah, I love the idea of
Point, I didn't even think of that. That's a big one.
yeah, and the number is larger. Now I saw a reference recently, but I read it briefly. I'll have to go back. It's almost doubled in 15 years, is what I remember.
Okay, well, that's like probably a lot of reasons, including the bureaucratic bloat and all the people that are like too many cooks in the kitchen going on, but
Yeah,
also like I think that's a good point because if you're not in your hospital, in the hospital, like in the traditional hospital setting that we've been in working in, then you will be safer essentially from falling, from
yeah,
delirium, from medication errors because you'll be at home.
yeah.
And
I'll I tell you, you send me a photo that you want me to put up when we go to put this into production, and I'll put one as well. But I remember vividly from the hospitals in South Africa, the patients would, after morning rounds, get together, walk outside with a cup of coffee, and you had this connection. You had, this different in our, and now every day in our private rooms, like it's incredibly isolating in the hospital, and families are busy. So there's this sense that yes, you have to be there when you need to be there, but it's great to get out of the hospital and people can wither away. So
yeah,
anyways,
I
yeah.
mean, I'm thinking so much of like, I think I'm just going to put it out in the ether in case this goes out there that people like us who have been at the bedside, including patients, especially patients, should be sitting at the table of the architects that design hospital buildings
Yeah.
and floors and wings. And also, with that in mind, like to have a green hospital like they do in Singapore, where plants and greeneries incorporated within the building. And in a perfect world, the building material would even be natural
Yeah.
from because we know how to do that. We just moved away from it. But yeah, I think it made me think of I went to my doctor yesterday and I was waiting in the clinic room and the fluorescent light was up here and I could hear it buzzing. And I was just like, oh, that is so
Right.
blinding. I had been outside that morning, so I was like from the garden
Yeah.
to the like hospital sterile buzzing light. And not that I expect like everywhere I go should be, lilies and roses type of thing, but I think it is now hard to separate
Yeah.
that what you like the environment that you're in contributes directly to your inflamed state or your brain health, your central nervous system,
Yeah.
like triggers and hormonal health, and all the systems they're
Yeah.
impacted.
Yeah.
And so
Yeah.
I think like this buzzing sound, we've already talked about that before. Sounds, senses, and all the things play a role in every encounter. So kind of what you were saying, they don't feel like they're even being heard. Well, when there's like buzzing and beeping, it seems hard to like
Yeah,
connect even.
for sure. Well, let's change gears. So we did a little bit of a review after the first day of Healthy Kitchen, Healthy Lives, and then we went to 2 more days. Let's just do a little bit of a recap of the end of the conference and interesting thoughts, or yeah, let's chat a little bit about the rest of the conference and food.
If we can, it feels like the rest, like since we've been back, it's been so busy.
It has.
And I think that has kind of limited how much time I've wanted to spend processing the experience of being there. But I think for me personally, I just think it's a beautiful combination of things. They had this huge garden they would collect food from, and then a physician would give a talk about something and then prepare a meal. Like I think that's right up my
Yeah.
alley. So I appreciated that part about it. Did I appreciate that the systems or the institutions are finally, at least seemingly, putting attention there? Sure, that's great too, but that was also a matter of time.
I think the organizers of the conference have been working hard to create that. And I think it's a celebration of, it's not like there was an endowed share from Heinz or that really just brought a lot of money to it and made it seem popular. It seems like this really organic, homegrown, haha, pun intended,
That's
effort.
it. It was very, very on the ground. What's it called? Bottom up.
Organic, homegrown.
Yeah, homegrown. Yeah. And so that is cool. And of course, I'm like still, I've cooked a few things since then, but had one, my garden stew. I've had some people over for that. And yeah, I actually think anytime I watch cooking shows or demonstrations, it goes into me, like into my subconscious, and just kind of comes out when I'm doing the next episode of cooking.
I will say, when we were leaving on the third day, walking to go have a celebratory birthday party, I think I commented that I definitely needed a burger. I definitely needed my red meat. But it was basically 3 days of I'm not even sure there was red meat. So the funny story is in my neighborhood, there's one of the little free libraries. There's actually we have quite a few in our neighborhood. So I walked past the one at the end of our block, and yesterday when I was walking the dog, there were two vegan cookbooks there. So number one, I was a little bit suspicious that they got put into the little free library of I don't know if somebody decided to give up their vegan traits or they looked like fantastic cookbooks, and I was like, well, I'm gonna snatch those up because number one, I hoard cookbooks, but number two, really, along with the lectures of the registered dietitians, food chemists about the overall need and impact to kind of get away from a meat, an animal meat. Well, I guess that's redundant. Diet was really impactful. So I got two cookbooks to help come up with some better ideas. And again, not that vegan is the goal, obviously, but I think it's fun to add in and to challenge, our palates and our cooking abilities.
For sure. I think you touched on some important points. I come from one of the earliest dairying societies in history in northern Iran. Like we were pastoral and there was dairy, rice, tea, all that stuff. And I can't ever give up cheese. Any discussion about strict veganism in order to save humanity or
Yeah.
whatever we're saying, I'm not trying to downplay it. I do think plant forward and plant focused is, what I practice. I think if there's a way, because back in the day, my ancestors, they were with the cows, they weren't using them, right? It was like that goes back to exchange. Like if you're in factories and you're like milking them in factories, it's different than there's
Right.
just like people living with the animals. It maybe sounds utopian, but that's how it used to be.
And I think just to set the record straight, I think we didn't make any dinner reservations. So I think we were all just going to figure out where we were. And then we thought, we'll cook some great meals. We literally had 3 nights of dinner of charcuterie.
Yeah, we were full. We ate all day long. I
Did.
remember being full in the evening too.
But yeah, otherwise it was evenings sitting around, catching up, chatting, and having massive charcuterie boards and pita and just, yeah, cute deliciousness all around.
I think you just reminded me that the way that we ate at the conference, which was like little bites here and there, that's actually how I keep my diet.
Yeah.
I usually have like a Mediterranean diet, plant forward. I do eat meat, but it's not often. But I get like you, I'll know when I'm supposed to have it. I'm like, oh, I need it.
Need a steak. What's the popular term going around for just making appetizers for dinner? I'll have to find it. You know me. I'm really well known to be on the cutting edge of social media and trends. So shocking that I.
Actually, I'm glad we brought this up. It's a good way to like kind of end the topic on food and the conference because I think the other thing that I thought about while I was there a lot is how food isn't just, and we talked about it too, isn't just what you put in your mouth, but the experience of it from when it's prepared to when it's going inside of you and what you're doing with, what setting you're in and how fast you're eating and how slow you're eating. So how we food,
Yeah.
societal level, I think that the conference just kind of ignited something in me that reminded me that I'm not just talking about food as medicine. It's not even that simple. It's like
Yeah.
so more complex than that. And the benefits of this pivot that at least you and I are having right now towards that, the benefits are multifactorial, right? Like there's like, I can name like 20 things
Yeah.
to make this shift as far as like having access to healthy meals, growing it yourself.
Yeah.
You don't have to have acres and acres. You
Yeah.
can really.
That, and I think kind of again, what is the purpose of food? It's to nourish. I think it was during the mindfulness session we went to on the second day, have made a bit of a more of a conscious effort to not eat at the computer. Like it's just, like the food has become a requirement and not like a mini mental break. So I have been sometimes it's just, I'll sit down with the dog and just enjoy eating without any distractions and, have a mindful moment. So that was a good takeaway.
That is a good point. You just reminded me, that's for sure. I'm so glad they brought that up because I feel like if I don't eat consciously, then I regret it. And that's okay. Sometimes I don't. So it's like staying consciously eating like 24/7 seems like a brutal way to be. But when I don't eat consciously, I still kind of I make decisions that are healthier because I know what could happen if you zone out and you're stressed out is you make the choices that are not good for you.
Totally. Totally.
I put them in front of me, or I'll be like, if I want to zone out, it'll be like these pumpkin seeds that I love.
Right. Yeah.
Of like really high protein.
Right. For sure. For sure. So, another thing is, I forgot what it was said, but basically the recommendations, the only liquids we should be having are coffee, tea, and water. So I've gone through a love, hate, and addiction relationship with Diet Coke for a long time. So recently, it has remotivated me to get back away from the processed Diet Coke. And I've seen two of the studies come out since, but I've always defended my own addiction to coffee and caffeine. And I'll try to put it up in our show notes. You need 2 million cups of coffee to increase your risk of atrial fibrillation. And again, having extrapolated, and we know that causation is not correlation, and population-based studies are not appropriate. But when I was doing my residency tried to say how bad coffee and caffeine were, I just would recall my time in Ireland with people who live for a long time and would have their 20 cups of tea a day, and in my mind doing the caffeine calculation, because the only thing in coffee that we perceive as harmful is caffeine, but caffeine is certainly a part of large culture. So I finally feel validated that there continue to be all these great studies that show lower risk of liver disease, type 2 diabetes, cognitive, and so we'll take it.
Yeah, I'm as one coffee lover to another. I am so fanatical about my only 1 cup really industrial strength French press French roast coffee every morning, that it didn't matter what anyone said about coffee because it was something personally that gave me good health, right? Like mood support, brain cognition support, as long as I didn't have it too late in the night. And actually, I think did we learn there that people metabolize caffeine differently.
Yeah.
So
Yeah.
I'm one of the ones that if I have it afternoon, I'll be wired all night. Even though
Yeah.
in culture they drink, like you said, they drink Persian tea constantly. And like sitting around and drinking tea and chatting is like
Yeah.
it's like a pastime.
Yeah. So this is a decaf tonight, but I go through phases where it depends what my overall caffeine consumption is and how much I'm working, but I can have decaf or caffeine often, and it's not an issue. I will also, so fun, I loved the fact that, yeah, when they talked about the different metabolism, because also, and I will have to go back and double check this, but we use caffeine, and then not behind me because this is fake, and then neonatal ICU when preemies forget to breathe and everything. And I'm going to test you. How many days does a baby have to be off of caffeine before discharge to prove that there's no more apnea Brady desats?
I have no idea.
Well, I'm sure that somebody will write in if I'm wrong. I think it was 7 days. And I never understood it. It's like, none of this randomized data. And then it was one of the pharmacists in the NICU who said because the half-life of caffeine in a preemie is actually something like 100 hours.
So that makes it, well, preemies, yeah. I mean,
and then I was like,
good point. I remember when we were in training, I was so surprised at the differences in metabolism because we would toggle between adults and children.
yeah.
And, the CFer or patients with cystic fibrosis, I know I shouldn't say it in that term, in that way, had such rapid metabolism.
Yeah. Yeah. And then also, or, use caffeine for spinal headache. It's not like they're wired for 2 days. So yeah. The joy of being Med-Peds, the extrapolation. So, well, it's good to catch up. Yeah, it's so funny. I was, as we were kind of leading up to today, this is the third day in a row we've tried to connect, and have misconnected. It's been really busy for both of us the last many months, kind of unexpectedly. I think, when we started this kind of fun experiment, we would throw some journal ideas around, have a little bit more structure, and we wing it. Anyways, that's what it's meant to be. And our shows will come out when they do. Sign up to let us know. But when what's going on for you for the next week or so?
I am getting ready to go international.
Yeah, it's gonna be fantastic.
Yeah. It's been a while. I took kind of a 3-year break. So I'm excited that I even have the energy to consider it. But also, it just feels like there's a lot going on in the world, and a lot of my international trips are forest bathing in nature. So, not that I need to get away. I had a friend say, "Oh, it's good to get away." Think it's really important to build a life that you don't have to get away from. And like,
Absolutely.
that's been a big goal of mine, and it's just something I commit to every day.
Yeah. Yeah.
I want to build a life I don't have to escape from. And when I want to travel, it's to go experience
Yeah.
nature.
And maybe some other regional good foods.
Culture, food, all that whole combination, of course.
Yeah.
It's always
Yeah. I think
different
yeah,
people.
right. We should do a Nessa Sanctuary podcast, and that'll get me back out to your sanctuary. And because I think that is really true, right? Is to be able to cultivate home as where you want to be, not where you escape from.
Yeah, and I think that my dream is for people because, some people can be like, oh, well, if I had a home in that situation, then I would be relaxed too. Well, that's true, but also just do it wherever you are around you. Just have these calming areas that you can go to rather than wait. Because this is the other thing I was talking about this yesterday. Why do we always have a countdown, right? Like, it's like, just do it now. Do the best you can now, obviously,
Like,
instead of
totally.
the perfect conditions. Like, and the other thing I know you and I both have been practicing because of our vans, we both have the camper vans. Is there a way to take some of those rituals and those habits that we're really kind of trying to establish on the go?
Yeah.
For me, I didn't think that there was for the past few years, which is why I kind of doubled down on my grounding techniques and learning and unlearning. And now I just feel like, I think in the end, the uncertainty of everything that's happening in the world, I feel like I have a better handle of how to manage uncertainty.
I think that's really well summed up. And again, it's been a process to get to where you are.
Yeah, I think.
And I think this small change and small perspective for sure.
How about you? What's going on next week for you?
I'm will be on service. So we'll be doing that, and then we'll have some time off and get up to Montana after a long hiatus. So looking forward to road trip up to Montana, and we'll be up there. Have not seen our friends. I would say friends and family. Our friends up there in a while. We'll be up there. There's a little bit of snow on the ground. Similarly, I'm looking forward to the car trip. It's 1,000 miles. It's a lovely drive. People think it's nuts and crazy, but it's very restorative and very zenful. And yeah, it's great. I'm looking forward to it. Well, you and I will catch up again soon. And yeah, everyone, thanks for joining. We've gotten a couple of questions and submissions recently. Our guests, just like us, to coordinate 3 challenging schedules. We were actually within striking distance of one of our guests. Who was so completely busy with great life stuff. So they'll be here when they're there. And until then, we just keep people guessing.
Happy almost spring, everyone.
Yeah, you too. All right, chat soon.
Bye.
Bye.
All right, now, that's a wrap for today's show. You can find us at www.whatthehellth.org or on Spotify or Apple Podcasts, and like and subscribe to our show. Remember, this podcast's for information and entertainment only, not medical advice. The views you heard are ours alone, not our employers. Y'all take care now and stay healthy out there.